All right, now we're on to our nurse practitioner students. So what we have here is a master's level course. It can take years to complete depending on the speed in which the student enrolls and completes their courses. So there's no real set time here either. Upon completion of the MSN FNP program, the student is going to be a nurse practitioner who serves as primarily like a healthcare provider, much like a family doctor. The nurse practitioner is going to work with patients throughout their lifespans. They're going to be diagnosing illness. They're going to be conducting exams and prescribing medication. They can serve as their sole healthcare provider and run their own practices, but they do have to have, in some states, like a co-signed kind of doctor who oversees them, although they may not provide all that much supervision. General concerns with shadow health. Mostly it's the volume of time it takes to do these assignments while juggling the other courses, work, family, etc. So again, points of discussion for that. I would emphasize the interview guide for the health history to give students an opportunity to kind of get in the rhythm and kind of understand the more in-depth interview that they're going to have to be doing, and then perhaps turn it off to test their learning somewhere down the line. I would again emphasize that this is a learning tool that can be used to help students practice and gain confidence in their assessment skills. It can be a big jump to go from an RN to an advanced practice provider. It's a lot more in depth and it can be a little bit intimidating. So this is a really nice way for students to really gain confidence in a pretty safe way before they head into their clinical practice. As far as courses go, we have a few that fit nicely here. Advanced Health Assessment, of course, fits nicely with their assessment course, and Pharmacology fits in very, very well with the Advanced Pharmacology. So what they really will be doing here is learning how to, put all of the pieces together with the prescription medications and being that provider that is prescribing. So this is a really nice way for them to practice in a safe area because, as we all know, medications can be kind of scary to prescribe when that's not something that you're used to doing. You're more used to just administering, and this takes it a step further into the prescribing. Foundations for Family Care, they can use that focused exam with Danny Rivera for their infant, children, and adolescent courses. For the adult and primary care, they can utilize those focused exams if they haven't already done so. And then their transitions course is their last course, and I would suggest maybe even having these students go back into their advanced health assessment course and just going through a nice review and then maybe doing these assignments again to see how they've done, from the beginning of the program until now, and they can really see the difference in their confidence. That is the basic overview for the family nurse practitioner level.